So hello friends, welcome you all to Sail to MDS Dental Academy. We are here with one more lecture. Today is our YouTube Premier lecture. Our chat box is open. You can question your doubts. We'll answer you guarantee. So dear friends, just we'll see what all live lectures we have seen in this complementary series. We have seen what after BDS part 1, what after BDS part 2. Last lecture we have seen NEET MDS preparation, that what, when and how to proceed. So dear friends, if you check that video description box, I have mentioned 15 questions which every MDS aspirants face in their life, and along with the question I have given timeline also, that between which to which minute I have explained that lecture. So in that, one important question is that how to approach the MCQ and change in exam pattern. So I want that you should please listen that 2 video again, okay, and if you have not gone through it, you just revise those 5 to 10 minutes will help you. So now this video is very important, but because the student should know that which type of questions they will come through. Before preparing for the exam, you should know how the exam is there. So that will help you in gauging your preparation. You can understand that where all you can make mistake and where all you have to strengthen yourself. It is completely like your SWOT analysis. You should know your strength and weaknesses. So friend, in this lecture we will see the different NEET and AIIMS pattern question. We will see the example so you all can get idea. Already I have uploaded one video regarding NEET pattern. So students are asking me, sir, can you explain one more video? So today we are with the Premier, so you can ask me your doubt. Fine dear friends, so remember, know the exam pattern well before preparing. Now let's come to a different type of question. So in NEET exam you have numerical based question. Numerical based means what? The value will be given. So whenever dear friend you come across such value, you cannot mug up the thousands of value given in your textbooks. So what you have to do? You have to do the comparative analysis. We'll see how you have to do. Now you can see in this slide the question is optimal water fluoridation. So whenever you see such question of numerical base, never ever in exam see the option. When you are practicing also, never see the option. Learn the correct value. Like for optimal water fluoridation, the correct value is 0.7 milligram. So you should know the correct value, because if you see the option, you are 100% you are going to get confused. And in exam you have around 10 to 15 questions such numerical based one, from the dental materials, from the OPath, from the physiology, etc. Fine. So whenever such value based question come, please learn the value, and you cannot learn all the value. So what you have to do? You have to go for comparative analysis. Now example, now setting time of different materials are there. So you should know setting time of 2 to 3 materials. Like you should know setting time of arginate, let's say 1 to 2 minutes. Then you compare, like the highest setting time is for the ZOE. After that setting time is for the condensation silicone, adhesion silicone. Like that you have to compare. So you can write in the examination. Fine. So the correct answer for this is 0.5 to 0.8 milligram per liter. Now we'll see one more such question. Now the question is APF, the amount of fluoride in the APF. No need to see the question, you should know the answer, 1.23%. Don't waste your time, just correct it. And if they ask like this in the milligram, it is 12.3 milligram per ml. Fine. Then the question arises like, what is the number of pharyngeal brachial arches? So like this question the question can come number of bones in the body, number of cranial bones, number of bones in children's. Now such question came number of cranial nerves, number of spinal nerves. So when such question come, know the value. Like here one shortcut I can tell, arches stand for 6 word, so there are 6 brachial arches. Normally students tend to write 5 brachial arches because the one get disappear, but remember there are 6 brachial arches. So dear friend, now hope you can understand that how you have to approach the numerical based MCQ. First, comparative analysis, and second, don't see the option, learn the value. Fine. Now we come to the multiple answers question. So everybody has seen the question single best answer. It is given you MCQ book, and many of time you might have across. Now see how the multiple answer question you have to solve. So you can see in this question, the question is which of the following are predisposing conditions for osteomyelitis. Now here the disease is osteomyelitis. Then you can see in the question they are not asked any specific thing like the main etiology or main condition. They have asked the predisposing conditions. So it is the multiple thing you have to answer. Fine. Then So it is saying correctly that the multiple thing is there, so the option will be more. So this D option is gone. Fine. Then you have to check each and every disease. For this you should have little bit knowledge for the osteomyelitis. Fine. Like you can see, chronic malnutrition, yes, it can cause osteomyelitis. Paget disease, yes, it can cause anemia, yes, it can cause diabetes insipidus. No, diabetes insipidus cannot cause osteomyelitis, but long-standing diabetes mellitus can cause. Then chronic alcoholism, yes, it can cause osteomyelitis. So the answer is A, 1, 2, 3, 5. Like this you have to solve such multiple answer question. And here our concept of 2 into 10 come. So whenever you are studying any topic, like for example you are studying ameloblastoma, at least learn 2 concepts. If you are feeling bored, at least learn 2 lines from that question. You'll be able to answer such question in examination. Fine. Let's see one more example. Now in exam, if they have asked the question on syndrome, it means the multiple option is there. Syndrome is never one option. And remember one more shortcut, whenever the examiner is preparing syndrome, they try to club 2 to 3 syndromes in the answer. Now here the question is about the Gowland syndrome. I hope anybody might not have heard about this Gowland syndrome. It is given the latest edition of the Naval. So what you have to do? Just see the option. Now precocious puberty. You know where you can see precocious puberty in McCune-Albright syndrome. Palmer-Pates, okay, there are a few things like a Palmer-Plantar keratosis C, but it is not in the option. Now Keffler's patches, yes, it is seen in the Albright syndrome. Now autosomal dominant syndrome, they are very rare. Now endocrine disorders, yes, it is also you can see in the Albright syndrome. So now you can see in this 5 option, the 3 are belong to your McCune-Albright syndrome, which is seen in fibrous dysplasia. So you have option 2 and 4 left with you. And as it is syndrome, you can answer without any doubt 2 and 4. Fine. And also remember, your Gowland syndrome is not your Gowling-Gose syndrome. Your Gowling-Gose syndrome, you can see multiple OKC, bifid rib, intracranial calcification, etc. Fine, dear friend. So whenever syndrome come, remember it's a multiple option question. Okay, and you have to know few common syndromes. So rule out those common syndromes and then go for it. So now in this question, read the question. Which of the following statements are correct? So here they mention nothing. Okay, they mention which of the statement is correct. Then directly look for the statement here. So first statement say lignocaine 0.2% with 1:80,000 adrenaline. It is already eradicated because we use lignocaine 2%. Second option is lignocaine has a longer lasting anesthetic effect than bupivacaine. No, it's wrong. Bupivacaine has a longer effect than lignocaine. Third is that plain lignocaine provide more dental anesthesia. No, we add epinephrine to decrease the absorption of local anesthesia. So this is also wrong option. The fourth option comes here, the pilocaine 3% with 0.03 intra IU unit ml felipressine is a commonly used dental local anesthetic. Yes, this option may be correct. Why? Because we know the felipressine has a least side effect compared to lignocaine. In most of the countries they are using felipressine as a dental local anesthetic. Lignocaine must be stored at 4 degrees. No, the correct the manufacturer recommendation is you can store lignocaine below your body temperature. Fine. So you can see all these 5 questions, the 4 options are looking absolutely false, and only one option is correct, that is 4, pilocaine 3%. So in such case select that option. Fine. Let's see one more question. Which of the following statement is or are true regarding acetylcholine? Read the option now. You know acetylcholine is a neurotransmitter, so it's a correct option. Yes, cholinesterase, it's an enzyme which help in cleavage of your acetylcholine. Then yes, acetylcholine has both muscarinic and nicotinic action, but the option 4D is looking incorrect. That is, it is a drug of choice for atropine poisoning, and we know the drug of choice for atropine poisoning, that is your physiostigmine. So the correct answer here is 1, 2 and 3 option. So again just we'll recap it, that what we have seen in this thing. See dear friend, first we have seen where they are given the disease and predisposing conditions. Here we have seen they have given syndrome. We have seen the syndrome based question. Here we have seen in question they have given nothing, just they have asked which statement is correct or incorrect. Fine. And then we have seen where the disease is given, and they have asked which, where the condition or a substance is given, and they have asked which is true or false. Fine. So in this manner you have to approach your multiple choice question. Either they will give plain statement, or they will give the disease, or syndrome will come. Let's come back to the one more topic, that is case-based scenarios. Fine. So whenever you are going with this case-based scenarios, always use your common sense. Let's say different pattern of question in this also. And yesterday one student has asked me regarding, if you are in my WhatsApp group, they have asked me that which bacteria can cause certain symptoms. Big question was that. But one more thing was there in the question, that is tumbling motility of bacteria. And everybody knows the tumbling motility is seen only in Neisseria. So just go with the option. So that's the identifying point you have to see in this case-based scenario. Let's see. The question is that a 50-year-old black man visit your clinic for replacing his missing anterior teeth, but he wants very white teeth in his new denture. What should you do? 3 points you have to focus here. Man is old, he is a black, and he wants very white teeth. So you know this will look completely different. It is not possible. Check out the option. Place the white teeth. You will not do, because it is theoretically and practically wrong. Second, you can show the patient suitable color first, and like this he will not going to understand, because he told he want very white teeth. Convincing by showing him or other patient photo. Yes, you can do it. You can go with the modeling. You can show the patient different example, so he or she may realize. Then third thing is that tell him firmly that the teeth color is good. This option is also wrong, because it's an old man. The psychological perspective is not like child. You can tell him and you can you command him. So the correct option is here is convince him by showing him old patient photos. Fine. So this is a very common sense question. So such common sense can be asked for your case-based scenario. Now here you can see I have given one more example. A patient is 6 years old, grossly decayed 7.4 and 8.4. Mentioned in the question, it is extracted, so there is a bilateral space loss, and the first permanent molar was erupted. Now which is the best space maintainer in this case? So the question is there, which is the best space maintainer? So option D will go, because you have to give space maintainer. Option C will go, because your first permanent molar was erupted. Now you have two options only, A or B. Now you should know a little bit about lingual arch, that we give lingual arch only when there is eruption of anterior teeth, lower anterior teeth. Okay, so here you can see in question lower anterior teeth, not there. So the correct answer is your bilateral bend and loop. So the identifying point in this thing is your first permanent molar was erupted. If in this it is written like first written like anteriors are erupted, then your answer is lingual arch. But here only permanent molar is erupted, so your answer is bilateral bend and loop. Let's see one more question. Now, like a patient is suffering from pain in the area of mandibular molars with paresthesia in the lower lip. So the question is pain in the area. So pain is what? Acute thing. Fine. Now check the option. Acute osteomyelitis, yes. Condensing osteomyelitis is a chronic condition. Chronic osteomyelitis is a chronic condition. Necrotizing osteomyelitis is also a chronic condition. So no need to read further question. You can write acute osteomyelitis. The answer is in the first line of the question only. Fine. Now we'll see in certain question what will happen. The first line will not give you answer. So you have to go to second line. Like you can see in this question, a patient experienced pain and some gingival swelling in the anterior segment of mandible. Now pain is there, gingival swelling is there. So you will not get clue, any clue, not proper clue you are getting. Read second line. The mandibular lateral incisor has a shallow restoration. It means what? The caries is not approaching pulp. Restoration is shallow, so it cannot be pulpal. TOP, you can see TOP both in pulpal and periodontal condition positive, so it's not that much important. And one more line is give a positive response to electric pulp tester. So the two things, that is shallow restoration and positive response to pulp tester, is showing that it is the periodontal condition. It is not your pulpal condition. Fine. Because the caries is shallow and your electric pulp test is positive, will be not there in your pulpal condition. So answer is lateral periodontal abscess. So friends, now true and false. Very simple thing. It's a bankable question. When it comes, you should not go wrong. So let's see two different true and false. So here you can see the question, which of the following statements about the intrinsic fibers of cementum are true? So question is asked, you have to find the true statement. So option D is not there in your back. D is wrong. Option A and B are false. So it should be out of contest. Now you should know a little bit about the intrinsic fiber of cementum. It is formed by your cementoblast. So option A is correct. It is intrinsic fiber, so it will not help in anchoring your tooth. So option B is correct. So here the answer is option A and B. So see what they are asked. Second come, which statement is incorrect for ZOE impression paste? They have asked incorrect statement. Fine. So you cannot be used as record undercut area. Yes, the statement is correct. You cannot use ZOE for the recording of undercut area because they have very poor reproduction ability. Second is thermoplastic setting material. Yes, it is thermoplastic setting material. Then the fourth option you can see is irritant and allergen. Yes, your eugenol can act both as an irritant and allergen. And option C you can see has a setting time, the rate of which decreases as humidity increases. It is completely wrong. The setting type of any material increases as your humidity increases. So the option C is correct. So whenever you see true and false, they are a bankable thing. Focus on the option what they have asked. They have asked a true thing or false thing. And whenever you are selecting option, try to compare two options. So as in the above question, we have compared the intrinsic fibers, cementoblast, and not help in anchoring the tooth. Here you have seen it cannot record undercut area, it's irritant and allergen. So the option C is correct. Fine. So this way you have to approach your true and false question. Now comes the EMQs, that is extended matching question. You can see 5 to 10 minimum question in AIIMS exam, but in NEET it is very rare chance that they can ask. But they can ask, we cannot say. So you should be prepared with this because in their portfolio it is given. Fine. So what's the extended matching questions? So in this question they will give you one theme, like they will give you one scene. For example, in your clinic one patient has come for the checkup. So you will have one theme that one clinic is there and a patient is there. Then they will give you some components, like they will give you X-ray, mouth mirror, probe, tweezer. Like 4 components they have given. Now they will ask you a question that you want to check the caries. So what you will do, you will use your probe and mouth mirror. So you have to select probe and mouth mirror. Then they will tell you to go for the investigation. Then what you will do, you will use your X-ray. So like that, it is an extended matching question. So theme will be there, components will be there, a scene will be there, and based on that you have to select your answer. Let's see a few ultimate themes. Like here the theme is prosthodontic components. So list of prosthodontic components are there, like abutment, clasp, movable joint, pontic, post dam, reciprocal arm, raised, retainer, set. So these are few 7 to 8 component. A theme has been given to you. Now let's check what are the scene they are asking. So first scene is there, which component of cobalt chromium RPD help in clasp to be functional and they also provide bracing. So let's go back to your component. So which of these components will help you in bracing and provide functional to the clasp? That is your reciprocal arm. Sometimes what happens, you have to select multiple option also. So here we have only one option, that is reciprocal arm. The second question is that the component of FPD which help in breaking stress and also help in movement across the bridge. So that is your movable joint which comes between your retainer and pontic. Okay. Then comes the term which is used to describe tooth or teeth to which bridge is attached. So that is your abutment. Understood? So that is your one of the theme for your E and Q. Let's see one more theme, that is for dental materials. So here they are given 5 theme. That's something used as canal irrigant, U for DPC, used for material used for apexification, help in passage through narrowing, canal narrowing, and can be a steroid or antibiotic paste. So you have to select. Now EDTA, for what can you use EDTA? EDTA can be used to pass through narrowing canal. Non-setting calcium hydroxide you can use in apexification. Setting calcium hydroxide you can use for DPC. Ladder mixed paste is your steroid plus antibiotic paste. Sodium hypochlorite, that is your canal irrigant. So hope everybody understood. So your theme, components, then the questions are coming. So these are the answers which I have already discussed. Fine dear friends, so that's the extended matching question. Again I am telling, you will have a case, you will have a scene, and a components have been given. Based on that, you have to select the particular component for the particular scene. Now match the following. So it is also one of the bankable question. If you go right with 1 to 2 option, you can easily answer the match the following. So first, I have kept very simple question. Everybody will answer. That's class 1 is normal, class 2 is retro, and class 3 is prognatism. So like this, you have to match your conditions. Now you can see in question 18, the question is match the term with appropriate definition. So definition has been given, like fibroma. So it is what? It's a benign neoplasm of fibrous tissue origin. Osteosarcoma, it is your malignant neoplasm of bone. Third is your hematoma. What is that? It's your blood that is secondary to trauma. What is squamous papilloma? It is your epithelial origin with finger-like projection. What is neoplasm? It can be benign or malignant tumor. So whenever you see such match the following things, try to be correct in 2 to 3 options. Then you can easily match the remaining. But you have to be sure. Exams, they will not put very simple thing. Okay, so for that you should be thorough with your match the following thing. Thorough with your definitions. Thorough with your sign. Like sometimes they will ask Chaustack sign, Trosses sign. So you should be thorough that in which sign which disease will occur. So please thorough your all the section 9 of your dental pulse synopsis. Now comes this sequence matching question. So in the sequence matching question, mostly it come from the oral pathology. Here what you have to do, you should know, for example, ameloblastoma is there. It is occurring in the 6 to 7 decade, oldest. AOT occur in the youngest people. So like that you have to arrange the thing. So I request all my dear students, before every section of your oral pathology, make 5 to 6 column, belong to age, belong to the site which is occurring, belong to the clinical sign and symptom, belong to the order of grading, and belong to the prognosis also. Like this 5 to 6 column you have to arrange. Now here you can see the question, the order of development and progression of oral SCC. Fine. So they have asked that which is the initial lesion. It can be metastatic SCC, epithelial dysplasia, or primer SCC. So it is your first carcinoma in situ occur, followed by primary squamous cell carcinoma, and at the last metastatic carcinoma occur. So in this way you have to match your answer. You have to match your sequence based question. Now you can see one more question, that is the application of your AIIMS. There is a composite step they are asking. You have to sequence your composite step. So here the question, first they have followed the total etch technique. So do you remember there are 3 types of etching technique: total etch, selective etch, and the self etch technique. Normally in cleaning we follow selective etch. It means we will etch differently enamel and differently dentine. You can check in my composite video. I will explain in detail composite everything. So here you can see what are the step sequence you have to follow. The first step will be your complete tooth preparation. Second step will be your etch enamel and dentine with phosphoric acid. Third step will come rinsing. Fourth step is application of primer. Fifth step, apply adhesive, that is a composite. And last, light cure. So like this 6 to 7 steps are there and you have to go with it. Fine. So such thing can be asked for your examination. That's a sequence based questions. Okay. So dear friends, now we'll recap what all we have seen. We have seen the single type answer that everybody know how you have to solve. Commonly thing, we have seen numerical based question where you have to go for the comparative analysis. Multiple answer question, we have to see which type of question they have asked, whether it's syndrome, a condition is given, or just they have given the statement. Then case based question, you have to find out the identifying points. 2 to 3 identifying points will be there in the question. True or false, bankable thing, study the question properly, match the following, know the definition and symptoms and signs of question properly. Extended matching question where you have the scene and components will be given and you have to relate both of them. Then we have to see the sequence based questions, as already we have seen. You have to arrange the thing in sequence. And there is one more category, that is assertion and reasoning question occurs. It is very simple in that 2 statements will be given, then they will tell whether the both statements are correct or they are related to each other or non-related to each other. Fine. So dear friends, now you can see how 8 to 9 types of questions they ask in the examination. So you can realize that only your MCQ reading is not enough to crack or to be in that top 500. you have to give a little bit extra, that is your referring of textbook. Your knowledge should be there. So that was all, dear friends. You can ask me the questions. Chat box is open for you. Anything you can ask me. Remember, our complimentary revision series going on. Anybody, those who want to join, they can WhatsApp me, they can mail me, or they can go to my website and register. From May 2nd week, we are starting with the full-fledged series. Second batch we are starting for this year. In that we will have the WhatsApp lectures, we have the online lectures, we have YouTube lectures, and we have MCQ exams will be there. For details you can contact me. So till then, dear friends, take care, study hard and study smart.